Rejection and liver transplant. What is liver transplant rejection? Before we learn about rejection, let's learn about the body's immune system. What is the immune system? The immune system is an important part of the body that helps protect against infections and cancer. It is made up of different types of cells, much like a country's defense forces, such as the Army, Navy, and Air Force. The immune cells important in rejection are mainly T cells, B cells, and antibodies made by B cells. The immune cells are always circulating in the blood, looking for foreign things. When they detect a threat, they get activated and attack. These cells are smart and are able to recognize your own body's cells and do not attack them. A transplanted organ is different from our own body. Rejection occurs when the immune system recognizes the donor liver as foreign and starts to attack it. What are the different types of rejection? There are two main types of rejection: acute rejection and chronic rejection. Acute rejection is the most common form of rejection and can happen at any time, but is more likely to occur within the first 6 months after transplant. There are different types of acute rejection depending upon which immune cell is attacking the donor liver. Acute cellular rejection occurs when T cells directly attack the donor liver. Antibody-mediated rejection occurs when the antibodies made by the B cells attack the donor liver. These antibodies can be checked in the blood and are called donor-specific antibodies, or DSAs. On the other hand, chronic rejection occurs if the acute rejection process does not completely resolve, or if it continues slowly over time and leads to permanent damage in the liver. It is more difficult to treat. What are the symptoms of rejection? Most patients do not have any symptoms of rejection and feel fine. Rejection is usually first noticed on routine blood tests. How is rejection diagnosed? Diagnosis of rejection requires a liver biopsy, where a sample of the liver tissue is removed with a needle to look at under a microscope. Analysis of the liver tissue can tell about the type and severity of rejection. How is rejection treated? Rejection is treated by giving medications to calm the immune system. Mild or moderate rejection is usually treated with giving high-dose corticosteroids, initially given intravenously, and then switched to an oral medication, along with increasing the dose of the maintenance anti-rejection medication. Severe or antibody-mediated rejection may require stronger medications. You can help prevent rejection by taking your medications on time. For more information, please talk to your liver transplant team.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.